This is a very exciting time for patients who have idiopathic pulmonary fibrosis. As you know, it's a disease that progresses over time, and for many, many years, really the only therapeutic option was a lung transplant. But the exciting results of the recent clinical trials have suggested that we're going to have new therapies for patients with IPF. The ASCEND trial, which looked at the role of pirfenidone in patients who have idiopathic pulmonary fibrosis, produced very exciting results, showed that the rate of decline in lung function was reduced by half over 1 year, and even suggested that patients could live longer who receive pirfenidone. So this is a very exciting time that obviously the drug is available in Italy. It's not been available in the United States where I'm from, so we're very hopeful that worldwide we'll have new exciting therapies for patients with IPF. So there had been 3 previous trials looking at the role of pirfenidone in patients with IPF, one from Japan, and then the capacity trials, which I was involved with, which looked at 2 different trials for patients over the course of 72 weeks. Although both trials showed that the drug had benefit for patients over 1 year, one trial was negative and one trial was positive at 72 weeks. So this pivotal trial was very important because it really looked again at 1 year the effect of pirfenidone for patients with IPF and showed convincingly that there was a significant reduction in the rate of decline of lung disease. So this is really the pivotal trial which tells us for certain that pirfenidone has a positive effect for patients with IPF. So the thing that's exciting about this trial is that if we can diagnose patients early in their disease with idiopathic pulmonary fibrosis, the key is to have no further progression. And what this drug does is it significantly slows that rate of decline. It's not a cure. We didn't see patients actually improving. But if we can slow that rate of decline, then we believe that we can extend patients' lives for many years. The drug is also, it's quite tolerable. There are side effects. Most drugs have side effects. And pirfenidone can have some impact on nausea, some gastrointestinal side effects. And some patients who go out into the sun can develop a photosensitivity. But the vast majority of patients are able to tolerate the medication. So it appears, and it clearly appears to be safe. There were no major effects in terms of bad outcomes or impacts on the health from that standpoint. So it's safe, tolerable, and slows the rate of progression. But we need more drugs in IPF. This isn't the end. This is the beginning of finding new and exciting therapies for patients who suffer from this terrible disease. The diagnosis is the utmost importance in IPF because there are a number of circumstances where you can get scarring on your lungs. So it's very important to determine whether it's due to idiopathic pulmonary fibrosis or some other cause. Other forms of fibrosis can be treatable in different ways. So it's very important to go to a specialist, a pulmonologist who understands, who has experience with IPF, because as you say, it is a rare disease and your average physician doesn't see many cases. So you really need to see a specialist to confirm the diagnosis and then get on the specific therapy.